So let's have a quick revision on 20 most important Ayurveda MCQs. Question 1. According to Ashtanga Hridaya, what is the total number of diseases that arise from Urdhva Jatruka? 231, 213, 221, 212. Answer is option A, 231. So in Ashtanga Hridaya Uttarasthana, it says, Jatru Urdhvajanam Vyadhinam Ekatrimshat Shadatvayam Parasparam Asankirnam Vistarena Prakashitam. There were described in detail 231 diseases. So answer is 231. Question 2. जिह्वा का कौन सा वर्ण का होने नष्ट आयु का घातक है? That means नष्ट आयु. During नष्ट आयु, what is the color change in the jihva? Krishna, Shyama, Neela, Harita. Answer is option A, Krishna. Ganjana Pradima va abhi tam gadam ayusham adichet. Krishna stabdha avalipta va jihva shuna cha yasya vai. Fatal sign related to tongue when the person is going to die quickly is if tongue is black, Krishna, stabdha static, avalipta cotted, shuna swollen. From Susruta, Sutrasthana, chapter 31. According to Ashtanga Sangraha, Bhruvorubhari Nimnayo is said to be the location of which marma? Abhanga, Shanka, Avarta, Utksheba. Answer is option C, Avarta. Bhruvorubhari Nimnayor Avarte Tayorantyam Drishte Ubhagado Va. Above the eyebrow, that is Bhruvorubhari, in depression of forehead, Nimnayoho, are two Avarta marma. And injury to this causes Antyam or blindness or Drishti Upagadam, disorder of vision. Ashtanga Sangraha, Sharirasthana, chapter 7. Question 4. According to Charaga, which of the following internal diseases is characterized by the feature of Sakti Sada? Vamkshana, Vrikka, Basti, Pliha. Answer is option A, Vamkshana. So let's see some symptoms of Vidradi according to some organs. I have not mentioned all organs. Yagrjayam Shwasa. So an infection or Vidradi to Yagrat may cause Shwasa. Plihajayam Uchwasa Ubharoda. Vrikkajayam Prishtakadi Graha. Nabijayam Hikka. Vamkshanajayam Sakti Sadha. Bastijayam Krichra-Pudi Mutra Varchatvam. From Charaga Samhita Sutrasthana, chapter 70. Question number 5. According to Susruta, which sandhi is in Amsapida? Tunna Sevani, Vayastunda, Pradhara, Samudka. Answer is option D, Samudka. The sandhi in Amsapida is Samudka. Amsapida, Gudabaka, Nidhambeshu, Samudka. Samudka is found in Amsapida, Gudha, Baka, Nidhamba. From Susruta Sharirasthana, chapter 5. And the Susruta Acharya mentioned 8 sandhis. Khora, Ullukala, Samudka, Pradhara, Tunna Sevani, Vayastunda, Mandala, and Shanka Varta. Question 6. According to Bhava Prakasha, which country's musk, that is Kasturi, is considered inferior? Kamarupa, Nepal, Kashmir, Saurashtra. Its answer is option C, Kashmir. Kamarupa Udbhava Sreshta, Naipali, Madhyama, Bhavet. Kashmira Desha Sambhuda Kasturi hi Adhama Mada. So Kasturi, Sreshta Kasturi is from Kamarupa. Madhyama Nepal, Adhama Kashmiri. From Bhava Prakasha, Karpuradi Varga. Question 7. Soft pink fleshy projections consisting of capillary found surrounded by fibrous collagen is keloid, granulation tissue, cellulitis, and collagen. Answer is option B, granulation tissue. So granulation tissue, the image is this. That is a type of new connective tissue that formed during the healing process of the wound. It is characterized by its granular appearance and rich blood supply. This is a critical component of wound healing, filling the wound space and promoting tissue repair. And the color is pink to red. Question 8. Tatra dash dhadunam sarva varnanam prabhava. Jala, Teja, Gha, Vayu. So which dhatu is for Sarva Varnanam Prabhava? It is Tejo Dhatu. Garbha Varna, color of fetus. Tatra Tejo Dhatu Varnanam Prabhava. The color of the fetus is due to Tejo Dhatu, that is Agni Mahabhuta. Susruta Samhita, Sharirasthana, chapter 2. So Garbha Varna color of fetus, Varna Prabhava is due to Teja. And Jala Mahabodha, predominant, it gives Gaura of the fetus. Prithvi, Krishna, Prithvi plus Akasha, Krishna Shyama, Jala plus Akasha, it is Gaura Shyama. Question 9. Svedam Alepanam, Sekam cha Ushnamannam, Avacharayet is indicated for treatment of which Visha? Ushnamannam. Ugravrichika, Ugraluda, Ugrakida, none of the above. Answer is option C, Ugrakida. Ugrakida Visha in Susruda Kalpasthana, chapter 8 is Dashtanugra Vishehi, Kidehi, Sarpavat Samubhajare. So, if the bite is by an insect of the strong acute poison, Ugrakida Visha, it should be treated as a Sarpa Visha, like snake bite. Vividhananto, Purvesham, Trividyena Kriyahita. So, threefold remedy to be employed in snake bite, according to threefold division of snake, should also be employed in these cases. Svedam, Alepanam, Segancha Ushna Matram Avacharayet. So, measures of Svedana, Alepana, Ushna Seka should be followed. Anyatra Murchidhatam, Damshad, Paga Koda Prapidatat, Vishaknancha Vidim, Sarva Kurya, Samshodhanani cha. Except in insect bitten patient. So, if there is an insect bitten patient, Murcha is there, that is a fainting. Due to suppuration or paga and koda, that is sloughing is there, then we have to report all kinds of cleansing, that is a vamana, virejana, etc. Also, anti-poisonous measure should be done. So here, this is cha ushnam atram avacharayet, not annam, ushnam atram avacharayet. Question 10. Which tree is called as Davala due to white bark? It is Arjuna. So from this picture you can see due to the white bark it is called as the Davala. Question 11. Which of the following philosophy is known as Ishvara Sankhya Darshana? Sankhya Darshana, Vaisheshika Darshana, Nyaya Darshana, Yoga Darshana. Yoga Darshana is also called as Ishvara Sankhya Darshana. Why? Because Yoga Darshana is something refers to as Ishvara Sankhya Darshana because it incorporates the concept of Ishvara into Sankhya philosophy framework of 25. So we know the 25 Tattva of Sankhya. And Yoga Darshana also include the Ishvara as the 26th Tattva. That's why Yoga Darshana is also called as the Ishvara Sankhya Darshana. Question 12. According to Charaka, in which Mahakashaya Chanda is included? Shwasahara, Kasahara, Shobhahara, Jwarahara. It is Shwasahara. So what is Shwasahara? It includes Shadi, Pushkaramola, Amla Vedasa, Ela, Hinku, Akaru, Surasa, Tamalaki, Jivandi and Chanda. From Charaka, Sutrasthana, chapter 4. Question 13. According to Susruta, the use of Bringaraja Rasa Siddha Thaila is considered as best in which disease? Hikka, Shwasa, Arojaka, all of this. In Shwasa, we consider, Susruta consider Bringaraja Rasa Siddha Thaila is best. So from chapter Susruta Uttaratantra, chapter 51, Thailam Dashakune Siddham, Bringaraja Rase Shupe, Sevyamanam Yatha Nyayam, Shwasakasa Vyabohati. So proper use of oil duly cooked in the combination with express use of Bringaraja. So 10 times Bringaraja is as much of oil and it is Shwasakasa Hara. Question 14. According to Susruta, how many types of Pradishaya are there? 3, 5, 6, 7. Answer is option B, 5. So, Pradishaya, Susruta, Vagbada, Madhavakara, Bhava, Misra, Sharkandara mention 5 types of Pradishaya. That is Vada, Pitta, Kaba, Rekta, Sannibhadaja. Whereas Charaka mentions only 4. Vada, Pitta, Kaba, Sannibhadaja, no Rektaja. But Charaka mentions Dushta Pradishaya as an advanced stage of Pradishaya. Question 15. What treatment should be done in Vada and Kabajanya Arshas? Mrudukshara, Aushada, Kshara, Agni, Karma, none of the above. Answer is option C, Kshara, Agni, Karma. Tatra Vada Sleshma Nimittan, Agni, Kshara, Abhyam, Sadhayet. Kshara Naiva, Mruduna, Pitta, Rekta, Nimittani. That is Arsha, Vada, Kabaja, Arsha, we do Agni, Kshara, Karma. In Pitta, Rektaja, it is Mrudukshara from Susruta Samhita, Chikitsa Sthana, chapter 6. Question 16. According to Ashtanga Hridaya, how many days should be there between the Vamana Virejana? 7 days, 15 days, 3 days, 12 days. Answer is option B, 15 days. Samanya Bhastikala. So in the Bhasti chapter, Ashtanga Hridaya Sutrasthana, the period of administration of enema is mentioned. Pakshad Virego Vamide Tadaha Paksha Niruhanam Sadhya Nirudascha Anvasya Sat Paratrad Saptaratran. There is a error here. It is Saptaratrad Virejitaha. Purgation therapy or Virejana should be resorted to after a fortnight. So usually after 2 weeks. So the time period between the Vamana and Virejana should be 2 weeks. And Niroha Vasti and after a fortnight after purgation. So Niroha Vasti and Virejana, the time period should be again fortnight. Means 2 weeks. Anuvasana Vasti can be administered immediately after the Niroha Vasti. But after 7 days after the purgation therapy, after Virejana, we do Anuvasana Vasti only after 7 days. So the day between Vamana and Virejana fortnight is 14 days, but in the question it is said 15 days. So 2 weeks is the time period between the Vamana, Virejana, and day between the Virejana and Niroha Vasti. Again, it is fortnight. Days between Virejana and Anuvasana Vasti 7 days. But Anuvasana Vasti can be done immediately after Niroha Vasti. Question 70. Nabi Nala Chedana should be done at what distance according to Susruta? So what should be the distance? Nabi Nala Chedana, Susruta. 6 angula, 12 angula, 8 angula, 4 angula. It is answer is option C, 8 angula. Tadho Nabinadam Ashta Angula Mayamya Sutrena Badhva Chedaye Tat Sutraika Deshancha Kumaresya Grivayam Samyak Badniyat. So umbilical cord after having been slightly drawn out should be ligature one end of a string at a point 8 fingers apart from the navel. The other end of the string is tied around the neck of the baby. Then the umbilical cord should be severed immediately above the ligature. From Susruta Sharira chapter 10. Question 18. Pakwadisara Nashano has been said for which gana? Priyankwadi, Ambashtadi, Nyagrodadi, A and B. Answer D. Priyankwadi, Ambashtadi gana both mention Pakwadisara Nashano. So Priyankwadi gana. Priyango, Samangha, Dadaki, Punnagha, Naga Pushpa, Chandana, Mojarasa, Anjana, Kumbika, Stoto, Jabat Patma, Ja, Stotoja, Padma Kesarayo Jana Yojana Valyo Dirgamula Chedi. Ambashtadiganam Ambashtadhadagi Kusuma Samangha Kadwanka Maduga Bilva Peshikasa Sa Vara Rodra Palasha Nandi Vrikshaha Padma Kesarani Chedi. And what is the indication? Ganau, Priyango, Ambashtadi, Pakwadisara Nashanau, Sandaniyo, Hidau, Pitte Vrananam, Cha Abi Robanau. From I think this is from the Charaga Susruta Samhita Sutrasthana, chapter 38. Question 19. Ovaries are connected to the uterus by which ligament? Broad, ovarian, uterosacral, infundibulopelvic. Answer is option B, ovarian ligament. Ovarian ligament connect the ovary to the uterus. So this is a picture. Ovarian ligament, also suspensory ligament of ovary, broad ligament is also there. So let's see what is this. Ovarian ligament is attached to the ovary inferiorly. We saw in the picture inferiorly, and it connects the ovary to side of the uterus. Structurally, it is a fibrous band of tissue that lies within the broad ligament, and this is a yellow is the broad ligament. It joins the uterus just below the origin of fallopian tube. Broad ligament is a flat sheet of peritoneum associated with the uterus, fallopian tube and ovary and extend from the lateral pelvic wall on both sides. Fold over the internal female genitalia, cover the surface anteriorly as well as posteriorly. Anatomically, the broad ligament can be divided to 3 regions: mesometrium, mesoovarium, mesosalpinx. And 3 other ligaments of the female reproductive tract are located within the broad ligament. So broad ligament we saw, ovarian ligament, then round ligament of uterus as well as the suspensory ligament of ovary, all called the infundibulopelvic ligament. Round ligament is a remnant of the embryonic gubernaculum. It originates at the uterine horn and attached to the labia majora, passing through the inguinal canal. Round ligament can be a source of pain during pregnancy due to the increased force placed on the ligament by the expanding uterus. Suspensory ligament of ovary. It extends outward from the ovary to the lateral abdominal wall. Consists of a fold of peritoneum. Thus, some sources consider it to be part of the broad ligament. Function of this ligament is to contain the ovarian vessel and nerves, that is ovarian artery, vein, nerve, plex, lymphatic vessel. Question 20. Sarvadhatu kshayartasya bhalam tasya hi bidabalam is said for whom in Ashtanga Hridaya. Gulma, Rajakshma, Kasa, Jwara. It is mentioned in Rajakshma. Prayena ubahada agnitvad sa picham adisaryade tasya adisara grahani vihidam hidam aushadam purisham yatnado raksheshusyade rajayakshmena sarvadhatu kshayartasya balam tasya hi bidabalam. Why? Probably because of the destruction of the digestive power, the patient developed diarrhea. In Rajayakshma, the patient developed diarrhea with slimy fecal matter. For this condition, treatment is suitable, which I indicated for the diarrhea. That is Adisara Grahani treatment we are doing here. Why? There is a destruction of the digestive power. So the patient is developing some Adisara. The fecus should be retained by all effect in a patient of the Rajayakshma who is being emaciated. Why? Because sarvadhatu kshayartasya balam. For a patient depleted of all dhatu, sarvadhatu kshaya, his balam means it is vit balam. All his strength is from the fecus only. Vit balam is bala of the Rajayakshma patient. So we should do all the property, that is all treatment for the strengthening of the fecus. Okay. So this is from the Ashtanga Hridaya Chikitsa Sthana chapter 5. Thank you for watching my video. For more updates, please like, share, subscribe my channel. Thank you.